So the first thing that I'd like to do then is to share with you some of the insights that I've had. I've been really lucky in my career to have done a PhD at the University of Central Lancashire, and with actually Professor Gill Thompson was one of my supervisors. So I've got this amazing connection to everybody in lots of different ways. And, you know, myself, Sarah and Gill, we've all taught each other, shared learning, you know, and translated knowledge and evidence and practice-based approaches all together. And that's something that I think sets the tone for the context of this maternity and midwifery hour. The kind of way I'd like to frame the hour is to really focus on the importance of us all having balance and creating coherence. Sarah and I work really closely, and Gill as well. Gill's done so much work looking at the importance of creating a sense of coherence and applying the beautiful philosophy and work of Aaron Antonovsky alongside the brilliant Professor Sue Down, who leads the REACH research unit at the University of Central Lancashire as well. In fact, Sue was the first researcher and midwifery researcher to apply the philosophy of Aaron Antonovsky to midwifery. And here you're going to hear me talking about that in relation to creating coherent nutrition and nurture policy, practice and research. So this hour is really to think about policy, and then thinking about how we can support practice through Sarah's presentation, how we can really strengthen quality care for families through quality education and education practice. And then Gill's going to share insights into research and what's been happening in the areas of research in relation to the Baby Friendly Initiative, and obviously supporting every family to get the optimal care around their infant feeding choices, experiences and outcomes. So this little session is just going to have 4 small parts. Just to share with you, you know, for some of you listening, you might not have heard of sense of coherence before. I like to think of it as balance. How do we get balance in our life? How do we generate well-being in our life? So it helps us, it gives us a little tool to think about that in a meaningful way, especially as midwives and maternity professionals. And then I want to think about, why does sense of coherence matter for policy, practice and research? And then how do we apply it to create coherent infant feeding and nutrition and nurture policy, practice and research, thinking about connections and collaborations. So what is sense of coherence? Well, I've already mentioned Aaron Antonovsky. What an amazing medical sociologist. And unfortunately, Aaron has died just recently, actually, but his life work will always be around for us to read. And, you know, I always love philosophers and researchers that write in easy to access ways. And all of his writing is so easy. So we've shared some of that for you, and the links will be shared with in the resources on the Maternity and Midwifery Forum website. So look out for those. But if you just want to search for his work, you'll really enjoy it. And Aaron really spent his life's work looking at how we can create balance in our lives and generate well-being, regardless of the context that we live in. So regardless of the stresses, which are just normal, part of all of our lives. So what is it in detail? Let's have a little look. Here's the lovely man. Here's Aaron. And he articulated through his research work, he started to notice, I'm really interested what generates well-being for people. And he generated a salutogenic orientation to health and well-being. So actually, when we break this word down, the Latin salu means health, and the Greek genesis means origins. So salutogenesis just translates to origins of health. And he was really interested in where does health originate, and how can we understand what makes us well and keeps us well? Sort of like an alternative to pathogenesis, which is the origin of disease. And obviously, of course, we need to understand both when we're working in maternity services and perinatal care services. So Antonovsky was clear in his research that stressors and stresses are ubiquitous for us all in our human lives and existence. You know, we're always going to be facing physical, emotional, social, financial, cultural pressure, stress, and that actually is quite normal. And so actually it's really important for us to understand how we can generate balance and well-being despite the stresses that we might face in our lives. That's really an important part of us helping to support families with that infant feeding journey. What he recognised is that our health and well-being in any area of our life, including feeding our babies and becoming parents, we're always on a continuum between healthies on one end and disease on the other. So it's like life's a continuum, and even in a day, we can feel like we're moving up and down that continuum. So just thinking about our health on that continuum is really critical, and I think really helpful when we try and understand how we can best support families with their infant feeding experiences and choices. So he also was really interested, though, to think about all the ways that we can develop resilience and resistance through all the resources we might have in our life available to us, so we can develop a resistance to some of the pressures and strains that can be normal and challenging through our life. So he kind of grouped these and called them generalized resistance resources, or GRRs. And I just think they're quite useful to think about. And actually, if you're supporting families, these are some of the things that you might want to work through with families as we prepare for becoming parents. Really helpful, or you can apply them to your own life as well. But he thought that's quite complicated. So he said, I want to make it more simple for people to understand this. So he actually continued to group all of these things into 3 core areas. And he said, actually, you know, in order for our life to feel in balance and for us to feel a sense of coherence in our life, we need to understand what's happening to us. We need to have the resources to manage what's happening, but most importantly, life should feel meaningful to us. Now, for us in maternity and perinatal care, we're so lucky that our work has meaning and can have a massive impact on the people that we support. And I think when you have a family as well, and when you've had your baby, for most people, that's also really meaningful to them. And so there's lots of meaning in our work and in our lives as new parents. So it's really important then for us as midwives or leaders of maternity service to think about how, though, can we create policies and practices that people can understand and can manage. And how can we remind people all the time of what's meaningful and what's our purpose? And so I noticed through this work, when I was working in infant feeding and doing my PhD exploring the Baby Friendly Initiative in the UK context, I thought, wouldn't this model be really helpful to help us understand how to best transform infant feeding care? So what about nutrition and nurture? Why does sense of coherence matter when we're thinking about the families we're aiming to care with that infant feeding journey? Well, we know that infant feeding can be quite a challenging time for some families. No matter how easy and smooth the transition to parenthood can be, we can always face hurdles along the way and bumps along the way. We're learning a new skill and it can be challenging. So we can face stresses and challenges, and actually the sense of coherence construct can give us some approaches that might help us to address those. We know that it's useful to use sense of coherence to help with our life consistency, to consider load balance as we adapt to parenthood, how we manage all the roles and all the practicalities of that, and also about the emotional closeness of those experiences as well. So sense of coherence can help us work through those together in our practice. Because really, sense of coherence and salutogenesis is really interested in the relationship between societal conditions and health. And obviously, everything we do as parents and everything we do in maternity care is really influenced by the political framework and landscape. So that's really important. And we always have known in infant feeding care that we must take care with the policies and frameworks and the way that the political landscape's impacting on us as families. So it's really important that we influence and continue to influence policies at every level to really centre the families that we're caring for at the local and individual level. So as midwives and maternity professionals, it's really important we're aware of policies and frameworks and continue to influence them. And indeed, baby-friendly initiatives are an example of how local practices influence global policy and now continue to be offering frameworks to guide ongoing local practice. What a beautiful iteration for us all to be remembering. So the Baby Friendly Initiative was born out of this political drive to strengthen infant feeding care and infant feeding outcomes and experiences, and created a global framework for us all to work towards, that's then adapted at a national level to a local level to inform everyday practice. So just that's been picked up by this little framework. In order for us really to develop these, these are all the really make sure that policy is a national, and this has been developed by Yale University and is really helping to drive national changes in feeding policy and how we can become breastfeeding friendly. I did my PhD and explored how the Baby Friendly Initiative UK context impacts on cultural settings in the UK context, and the cultural practices and experience of both staff and service users. So you can read my study in more detail, but I was really interested in how the national picture of the UK UNICEF Baby Friendly really adapted that global policy to a national context across all of these professional areas, both in the hospital and community context. And that what I loved about the policy was that it really centred caring connections for all, focusing on close and loving relationships. And my study, just this is a snapshot of the things that I explored and found, was that of the baby-friendly framework in the UK, with this focus on relationship-based care, helps to create an amazing coherent policy framework for helping midwives to remember who they are, to focus on the relationship, and to have a language to use to help them with the understanding and the tools to manage infant feeding support in everyday practice. And that was such a beautiful coming together of informational, practical, and emotional frameworks to guide us in the work that we do, really closely aligned to the sense of coherence construct. So the policy and framework and guidelines itself actually offers a sense of coherence policy that I believe other policies could use as a benchmark to guide meaningful frameworks for relationship-based practice and care. So here you can see that whilst we can't always change the context of postnatal care and care environments, they continue to be busy and stressful and pressured by the mechanics of time and competing cultures and busyness. Actually, the framework of the baby-friendly standards and effective leadership and team approach that is taken in baby-friendly accredited services helps to counter and create balance to those pressures, and offers that coherent support to drive positive change and to offer meaningful experience to families. So collectively, sense of coherence can offer really useful frameworks when we're developing policy, such as infant feeding policy. For example, an example of that would be the baby-friendly frameworks and policies. But also we need to join that with a balance of effective leadership, both transactional and transformational, a real collective team approach, which we're sharing here today, the importance of sharing across research, education, practice, and then also the importance that policies in the future could use the benchmark of the baby-friendly UNICEF UK policy to help as a guide on how we might move maternity care forwards.